Hi class. Today I'm going to talk to you about how there's a killer among our communities and affecting our nation. We're in the middle of an unprecedented epidemic that has resulted in more deaths than HIV, gun violence, and even motor vehicle accidents combined. This particular epidemic has resulted in more than 500,000 deaths according to the CDC. The opioid epidemic defines the increasing number of deaths, overdoses um, from opioids, including illicit drugs, synthetic substances, and even prescriptions. I'm sure you're wondering why or how the opioid epidemic affects you. Well, it affects people of all ages, races, social standings, financial backgrounds, and even ethnic backgrounds. The opioid epidemic effects can be felt by people who don't even use drugs. It could be a family member that's addicted to an opioid. It could be a friend. It could even be a coworker. It could just be your community has been hard hit by this horrible epidemic that's taken over our nation. So today I want to educate you on what the opioid epidemic is, how we got to this point of crisis, and what our government is implementing and trying to do in order to solve the epidemic. Opioids are essentially psychoactive substances that occur naturally within a poppy plant. It occurs within the resin of a poppy plant. It can also be produced in labs. And how they work is by attaching themselves to opioid receptors within the central and peripheral nervous system. They can even attach themselves within the digestive tract. There's illegal opioids such as heroin, but there's also legal opioids, which includes prescription drugs that you get from your physician and for pain relief. So it could be as simple as you went in for a major surgery. Let's say you had a knee injury and you went in to have it fixed and repaired. Surgery, they give you a pain reliever that's an opioid, and then next thing you know, you've become used to it and you're taking it on a regular basis, even though you don't need it anymore. Opioid pain relievers are normally safe when prescribed by a physician and taken for a short amount of time as prescribed by the physician after a person has been injured or has pain. But the problem is that along with that relief that the opioid gives, along with that pain relief comes a euphoria that that people get used to. It relaxes them, it makes them feel good, and then next thing you know, the person is abusing those opioids. So there's four types of opioids. There's the natural opioid, which are nitrogen containing based chemicals, compounds that naturally occur within the poppy plant. These such meds, natural meds that are created are the codeines and morphine. You also have semi-synthetic opioids produced in a lab from natural opioids. So they're produced in a lab from the poppy plant. Things such as hydrocodone, oxycodone, hydromorphine. These are all semi-synthetic, so they come from a natural place, but they're created in a lab. Then you also have synthetic, which is entirely artificial, nothing natural about it. These are your drugs such as fentanyl, methadone, and tramadol. And then fourth, and not to be forgotten because it's a huge issue right now, is heroin. It's an illicit or illegal drug made from morphine, which is something that's essentially normal or natural. And heroin can come in a whiter brown substance. It also comes in a blacky stick substance, also known as tar heroin. So now that we've kind of talked about what opioids are, let's talk about how we got here to this point. And so, how our nation got to this point is based on emerging of different circumstances. The first round includes increased prescribing by doctors and physicians. Um, what happened is drug companies in the 90s said, "Hey, these opioids, they won't. Your patients won't become addicted to it. Um, they won't become dependent on these pain relievers." Um, and so doctors, okay, great. They provide great pain relief. We're going to prescribe them even more. So that was the first reason. And then comes 2010. We have a rapid increase of overdose deaths because of heroin. And there's an influx of potent heroin coming in across the border from Mexico. Um, and so that, in addition to powerful opioids such as fentanyl being made here in the U.S., that was the second round, which started to cause a lot of deaths, a lot of overdoses. And then last but not least are the synthetic drugs. So the heroines, and then what happens is somebody goes and buys heroin and, or fentanyl, and it's laced with one of these other opioids, not knowing they think they're just getting a high like they would anything else any other drug, illicit or street drug they've bought before, and they end up either overdosing or they end up overdosing and dying. And then last but not least, 2013, with the significant increases in deaths, including synthetic opioids, um, those manufactured with fentanyl. So now you know how we've arrived at the crisis, um, and what was taking place, and these three reasons that kind of all came together and started to build on each other for the last 20 years that has increased this. Now let's talk about what's being done to solve the epidemic. According to the CDC and the American Journal of Public Health, the following steps can begin to help to solve or alleviate the crisis some. So one, public awareness, talking about it, getting out there, letting people know that this epidemic even exists, and letting people know about prescription opioid abuse and overdose and how to make safe choices if your doctor does prescribe opioids for you. Also, the lessening, providers are now the government now has a tight rein on prescribing opioids to patients. Why are you prescribing it? What is it for? How many you can prescribe in a certain amount of time. Two, also outfitting the different states with resources, increasing data collection, supporting the use of evidence-based approaches. There's a program called Overdose Data to Action. It's a collaborative agreement that seeks to improve data timeliness. So making sure that those and comprehensiveness, making sure that those statistics and that data is being collected quickly and being turned over to the Department of Health and Human Services, and so that that data can turn around and be like, okay, what is what we're doing now currently working? What else can we do? Also, to inform the public of health response and prevention activities. And then the third thing they're doing is developing research by collecting and scrutinizing that data on opioid related overdoses and improving data quality to better pinpoint areas that may require more assistance. So they're doing their best to attempt to alleviate what's going on as far as the epidemic is concerned. Also, to 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 really enforce those prevention efforts. So making sure people are aware of what's going on in their communities and in the nation as far as the opioid epidemic, and really having communities take a stand and really look at prevention measures. To conclude my speech, we've seen how devastating the epidemic can be to our nation and our communities, and exactly how we got here and how we begin to solve the problem. The opioid epidemic has become a national health crisis with devastating effects, including increased abuse, and related overdoses and deaths. The epidemic is a top priority for the U.S. Department of Health and Human Services, and they continue to develop new programs to help fight this epidemic. I hope that you did learn something, a little bit of something today. Thank you for listening. This is a topic that's super passionate to me, as I work with a lot of substance abusers every day that seek treatment in the clinic I work for. So I hope you learned a little something, and you will hopefully do some research on your own and start to talk to your community and your family about the opioid epidemic, which will only increase the preventative measures and that the Department of Health and Human Services is trying to take. Thank you.